The Ministry of Health together with UNFPA have conducted a symbolic 8 billionth baby commemoration in Uganda at Naguru Referral Hospital.
A lot of good memories being born here. The number 8 billion here in Naguru. We visited the symbolic baby that the world now has 8 billion people. What this one means, which, when you put it in the context of Uganda, even the population of Uganda has grown. We have one of the highest population growth rates.
The celebration of this day provides an opportunity to catalyze conversation on population dynamism of sexual reproductive health and ensuring right choices.
The infinite possibilities of humanity to build the world that we want, of course, with sexual reproductive health and rights as its core.
Celebrating 80 billion as a population requires refocusing on the quality of population than in numbers. This is expected to facilitate socio-economic transformation.
Since youth and women do not have access or sufficient access to healthcare and social protection, and are also unable to complete quality primary and secondary education.
We have big challenges like 25% of our population, of our women who get pregnant are teenage mothers, babies giving birth to babies. That one we don't want because it affects their progression to be productive. We have one of the youngest populations in the world.
The Ministry of Health plans to strategize mechanisms of creating awareness on the reproductive health information among young adults.
On our side, we have interventions that are going to help mothers and families decide when to have babies. That is family planning, which we are pushing as a development issue. We want a couple to decide when to have babies. We no longer want babies by accident.
Despite the reducing mortality rate, medical workers decried the wanting working conditions and limited human resource compared to the number of patients to attend to.
I'll cry to the director that I do not have midwives. We request that that is taken into care, into consideration. Then as we talk about respectful maternity care, we also need to care for the providers. You cannot provide what you do not have. You need to be cared for as a provider. The welfare of the providers, the midwives, the doctors, the nurses need to be taken into consideration.
The celebrations come with warnings of economic inequality. It has been observed that countries with highest fertility rate tend to have the lowest income per capita. Abdul Nasir Lubwama, UBC News.